Hi, I'm Holly, and this is my presentation on the MTHFR gene mutation. So what is the MTHFR mutation? MTHFR stands for methylene tetrahydrofolate reductase. This gene produces an enzyme that aids in amino acid production, including homocysteine and folate. MTHFR enzyme is a key component in folate and homocysteine metabolism. The MTHFR gene carries out several processes within the body, and therefore a mutation can lead to several various conditions. The MTHFR gene mutation is fairly prevalent. Did you know that at least 50% of the population has the MTHFR mutation? This is one of the more common gene mutations. The MTHFR mutation is needed for the process of methylation. Methylation is when a methyl group transfers from one compound to another. The process of methylation is needed for over 400 biochemical processes that happen in our bodies. The MTHFR enzyme methylates folic acid from our food into the active form of methylated folate that the body can use. The active methylated folate converts homocysteine into methylene that synthesizes neurotransmitters such as dopamine and serotonin. MTHFR enzymes remove excess homocysteine to maintain homeostasis and safe levels of homocysteine in the blood. If excess homocysteine is not converted into an inactivated form, it causes inflammation. This can lead to complications such as high cholesterol, high blood pressure, cardiovascular disease, stroke, blood clots, chronic pain, anxiety, and depression. Additionally, high homocysteine levels can also disrupt sleep, decreasing sleep hormones like melatonin. There are over 30 types of MTHFR mutations. The two most common types are C677A and A1298C. The C677A mutation causes up to 70% reduction in enzyme activity with a double gene mutation. A double gene mutation is when you receive a mutation from both parents. A1298A mutation is a less severe type of mutation, causing a 40% reduction in enzyme activity if you have a double gene mutation. You can also have more than one type of MTHFR mutation, and having two types of these mutations means that you will have severe compounded effects. A MTHFR mutation means that you may be able to convert some folate from an inactive form to an active form. However, it may not be enough to meet your body's needs. A MTHFR mutation that causes folate deficiency can lead to several effects in pregnancy. Severe folate deficiency can cause neural tube defects, cleft palate, and congenital heart disease in newborns. Inadequate MTHFR enzymes cause a reduction in detoxification within the body. Additionally, this gene mutation can also cause repeat miscarriages and infertility. So here are some clinical considerations for midwives. Pregnant people with a history of repeat miscarriages, infertility, or a family history of MTHFR diagnosis may opt to seek testing. However, MTHFR testing is not routinely recommended by ACOG guidelines or by the American College of Medical Genetics. However, MTHFR mutation can be tested with a lab blood test anytime prior to conception or during pregnancy. Some people with MTHFR mutation may not show symptoms due to this mutation being silenced, either from diet, lifestyle factors, or epigenetics. People with the MTHFR mutation that do not show clinical signs may not need any treatment. Elevated methylated folate can decrease homocysteine levels, which can cause inadequate levels of homocysteine needed for neurotransmitter production. In other words, if you really don't need folate supplementation in a high dose, then it may be unnecessarily to take that supplement in a higher dose and can actually cause some undesirable effects. Here are some considerations when it comes to foods. Safe options for everyone include increasing folate-rich foods such as asparagus, avocados, broccoli, kale, citrus fruits, bananas, berries, and eggs. Something to consider, though, is that food sources are not methylated, that is, not an active form of folate, and therefore an inactive form of folate cannot easily be absorbed by people with MTHFR mutations. This is advised also that people with MTHFR mutations avoid things such as coffee and alcohol because they increase homocysteine levels. Other considerations include switching to an anti-inflammatory diet, such as gluten-free, and opt to consume organic foods whenever possible. In conclusion, I would like to highlight additional treatment and clinical considerations. MTHFR mutations should be treated if there are clear symptoms or lab biomarkers, such as elevated homocysteine levels. Methylfolate, or 5-MTHF, is the active form of folate that does not need to be converted or absorbed to be used in the body. Other supplements that support folate absorption include choline, vitamin B6, and methylated B12. Although folic acid, which is the synthetic form of folate, supplements are often recommended in pregnancy, people with MTHFR mutations are unable to process this inactive form of folate. Current evidence is inconclusive for whether MTHFR mutations should be tested for in pregnancy or treated with L-methylfolate instead of folic acid supplements. However, some research demonstrates evidence that routine L-methylfolate supplements in the first trimester and beyond have potentially positive effects. L-methylfolate may decrease miscarriage rates and poor pregnancy outcomes such as preterm labor, preeclampsia, premature rupture of membranes, and neurotube defects in people with MTHFR mutations. Additionally, research evidence states that L-methylfolate supplements in pregnancy may have long-term protective neurocognitive effects and improve psychosocial development in children. I hope this presentation on MTHFR gene mutations has been informative and that you will find value that you can implement in your clinical practice as midwives. These are my references. Thank you very much for joining my presentation today.